Welcome to the Human Capital Innovations Podcast, your go-to source for personal, professional, and organizational growth and development. We hope you tune in often for all things people management, organizational development and change, organizational leadership, and social impact related. Maximize your personal and organizational potential with Human Capital Innovations Podcast. In this HCI podcast episode, HCI Research Associate Dr. Leandra Hernandez and her colleagues hold their first COVID-19 weekly Convo live Facebook event to discuss all things COVID-19 related.
What has been on you guys' mind this week? I feel like mine changes every day. I don't even have coherent thoughts right now.
I kind of feel like the squirrel, where it's like 1 minute I'm thinking about one thing and then it just keeps expanding and chaining out.
Yeah, what's very clear to me is that I always thought I was going to do all these things around the house if I just had more time, and that's not happening. And also, I don't actually have more time.
Yeah.
No. Yeah. Yeah.
That's what I've been feeling like recently. Like, I thought I was going to have so much time in isolation. I have less time than usual. Everything takes longer and is more complicated.
Yes, indeed.
Right.
And
because, companies still expect you to work, right? So.
Yeah. But
we're lucky, though.
We're lucky. Yeah. I'm feeling very lucky.
Yes,
right now.
Indeed. I mean, I'm, seeing the kind of, expressions of distress all across Gainesville right now on the local boards, restaurants sort of desperate to, they talk about inventory, and people losing their jobs. So it's tough out there.
I keep thinking about graduate students who are finishing PhDs right now and about to go on the job market or on the job market. It's just, the job market is so brutal already. It's
and the number of searches that you've heard canceling.
Yeah.
And small institutions cutting budgets.
Yeah.
We can't talk about that around me right now. I can't sleep.
Yeah.
Oh my God.
It's scary.
San Francisco Art Institute, losing its, basically closing down, apparently.
Mm-hmm.
What did you say was the Moody Institute?
The San Francisco Art Institute. It's one of the oldest, art schools on the West Coast.
Oh my gosh. Yeah. Small liberal art schools are just going to disappear through this, I think. I mean, not all of them, but I think any that were already struggling and wondering how to keep going for the next few years. I mean, this, I don't know. I don't know a whole lot about university finance, but my gut is if they don't have $100 million in their endowment, I just think they're not. But then people are saying they can't even access their endowments right now because most of that's in the stocks, and with the stock market crashing.
Yeah, this is not the time to pull money out of your endowment. You're hoping to cover. But if you rely on the income from those endowments for so many things,
right,
that income is going to go down in the next quarter.
Yeah, right. Yeah. Nothing's made me more happy that I don't know how to invest in the stock market. Sadly safe there, I guess.
One small potential positive for us in higher education is that oftentimes people do pursue more education in economic downturns.
That is true. That is true.
And
I've heard that there's many
that's something to be happy about, but it's...
Well, I was wondering that too. I was seeing that people are adding another degree on right now because they don't know how to go into the workforce.
I think one of the things that everyone is trying to figure out right now is for colleges that have dorms and for a lot of the people who manage housing around universities, people are having to leave. They're having to go home, and they've paid rent, and with the expectation of paying more rent. They're all under contract. On the one hand, that rent should certainly be refunded and forgiven going forward. But on the other hand, many of those places rely on that income.
Right.
So there's no real easy solution to it.
Yeah. It's just going to,
Kari.
Yeah. How has it been for you in Florida, Pam?
Well, I mean, specifically, hi. It's been a bit crazy here because our governor isn't actually he's not pulling the trigger and really clearing places. So locally, Alachua County has made what I think is the right decision and asking people to shelter in place. You know, in practice, it's all a bit fuzzy. It's all kind of unfolding as we go. But, you know, the beaches down south are still full of people and lots of places are still open. And Florida is right now a hotspot, which means in 2 weeks we're going to start to see a lot more, first of all, and we'll start to see the serious mortality. And we're, you know, an older population. So it's not great. But we are hoping that our governor will, you know, that his position will evolve.
Yeah. Yeah. Hi, welcome.
Oh, hi.
Hi.
Kari, do you want us to each introduce ourselves?
It's a great idea.
That might be good.
Yeah.
Okay, I can start. So I'm Jenn MacLure. I'm an assistant professor at Kent State University. I study Victorian literature and as well as medical humanities. So I think Kari and I met talking about disease in Bleak House. And now just this week, that article that we were talking about has just come out.
Yeah.
Very accidentally, very time relevant. That was not on purpose, as we all know with the academic publishing timeline.
Right.
Yeah. I'll go. My name is Leandra Hernandez. I'm an assistant professor in the Department of Communication at Utah Valley University, which is just south of Salt Lake City. And my research interests focus mostly on representations of health in the media, in the news. I focus a lot on media ethics approaches to health. And Kari and I went to undergrad together. So the really cool thing is that Kari and I love to tell everyone that when we were in undergrad, we were acquaintances, but have gotten a lot closer as we've gotten older over our bond of all things spooky and morbid. So.
Well, I'm Pamela Gilbert, and I'm a professor of English at the University of Florida, and I regularly teach a literature and medicine course. I do a lot of history of the body and some history of public health in Victorian Britain. So I have a couple of books on the cholera epidemics of the 19th century and how they reshaped public health and how also various constituencies responded to those epidemics at the time and really shaped a discourse of what public health was supposed to be. This was, of course, before germ theory, back when people still thought that miasma caused disease. And so really a lot of not only modern public health policy, but modern sewerage, the city as we understand it, has kind of came out of that period.
This is Andy. She and I met doing, we were on a panel together on Ash Wednesday that a church did. They wanted to do a death panel, and Andy and I met there. Do you want to tell a little bit about your job and whatever you're willing or can share? I'd love to hear what hospitals look like right now. I know obviously most of us don't go to a hospital daily, and now it's like you want to stay away at all costs, but I feel like it must be total chaos.
Yeah. I'm working from home. Everyone who isn't providing direct patient care as a primary provider is staying home. That's how things are. So medical consultants of every kind are working from home and connecting with patients with their iPhones, iPads, chaplains, social workers, infectious disease. Anyone who's not doing procedures or anyone who doesn't need to lay hands on the patient to provide a diagnosis is working from home. which is really unusual for folks. So it's a mixture of people who are totally overwhelmed in their work and hours and volume, and then there are physicians who, all of the clinics have been closed across the state to shunt providers and staff from the clinics to the hospital acute care. Our emergency room is everything has moved upstream to the fairgrounds. So even so Seattle has a hospital that they're kind of a triage hospital on a soccer field that they're using. We're using our fairgrounds in Spokane, and both hospital systems in town. We have 2 systems, 5 hospitals, and our emergency rooms have been working together to screen people at the fairgrounds before ever going to the hospital.
Are you able to screen them effectively? Is it just temperature screening, or are you actually able to test?
Nope, we're able to test. Yeah. So that's one of the things that's changed dramatically in the last week. This week's testing is much better than last week's testing. And testing was causing a lot of moral distress. Just not being able to test and not having access to the test. There was a point when there were multiple hospital labs, university labs, that were trying to come up with their own test in the absence of an available test. It was being funded by, at least folks in Washington were being funded by the Gates Foundation to work on that. And
the turnaround time? I'm sorry, Andy, I didn't mean to interrupt you. What's the turnaround time on tests?
So good question. I know that there's one that they're working on that's within about a 4-hour turnaround or quicker. Right now, what I'm hearing is that it's a 24-hour turnaround. 3 weeks ago, it was 3 to 4 days. It was 3 to 4 days from the lab receiving it, and it was a mail-away lab, so it was really taking 5 to 7 days. So one of the things that, our West Side hospitals are layering their hospital floors. So one floor is COVID positive, one floor COVID negative, one floor COVID rule out, or the orders, I think, are different than that. Trying to keep staff in exposed, potentially exposed and unexposed. Because the reality is that with there's been a lot of talk about how ventilators will be allocated from the strategic national stockpile. And the reality is that the Department of Health is saying, gosh, if you don't have staff and you don't have PPE to run the ventilators, we're not going to distribute this to the hospital, which I think is that's proportionate.
Holy heck.
Mm-hmm. So what we might see is that it's not actually the ventilator shortage or the ICU bed shortage that causes us to tip over into crisis standards of care. It might actually be staff and PPE. And that's not anything anyone expected.
Right. It certainly hadn't been what I would have thought about until you sent me some of that literature for the meeting tomorrow. I was thinking ICU beds and ventilators, not staff. And then just the way that you came in and said that they've got all of the doctors that don't need to be there working from home. Like, that feels like a movie where we have to almost triage protect the doctors that we're going to need. Oh my God. It's
well, it keeps patients who are not urgently in need away from clinics and hospitals that are becoming hotspots, really, because people who are really sick are going there. They canceled all non-essential procedures and care days ago here in Gainesville.
Right. Yeah, I was, this is of course a minor need, but it was just showing me how deep this is running right now. I was kind of looking into getting some physical therapy for a little back problem. And it's you can't. There's you can do a phone appointment, but you can't get a PT eval via phone that's effective. And of course that doesn't, really matter, and my life is fine. But it just showed me how not normal we're operating right now. And but I think that's good that everybody's taking it that seriously to even shut down most doctors' offices and really focus on.
Yeah. So I'm seeing in the public chat.
There's been a lot of questions.
Yeah, Kristen Soria is one of our ethics champions at Sacred Heart Holy Family, and she's the nurse coordinator for stroke care. And she's saying that on the ground, having a lot of issues with getting test results. You've been waiting 8 days now. Holy cow, Kristen! Wow. No, I'm just responding to that.
Yeah, I'm hearing informally from people that test results, we're still not testing everyone here, and test results are taking a lot of time. We had, the situation here was we're a university of 50,000 students. We're in a small town. It's a university town. It's sort of a classic university town. And so people came back for one day after our spring break, which was fairly early. So they brought the students back for one day, and, it was obviously an evolving situation. People were making the best decisions that they could. And that night they said, okay, you need to prepare to go online. But already a lot of people had come back from vacation, and probably would have anyway. They would have come back to get their stuff from their dorms and whatnot anyway. But that has made Little Gainesville in Alachua County a hotspot in the way that we're not seeing elsewhere in Florida except for major cities.
Right. Andy, can I let you take this question about splitting ventilators? I certainly don't know the answer to that.
Yeah, I don't either, but I've seen, I'm on a couple Facebook forums with other physicians, specifically palliative care physicians, and then we've been trying to connect with our critical care providers as much as possible, just to talk through some of the innovations that are coming out of the desperation. And so I guess my biggest question about splitting ventilators, I think it's a good attempt and a good idea, and with an attempt to try to decrease the number of staff that we need. I think a much more pressing thing is talking about what we won't be doing. For instance, 2 full-time nurses can run can see 4 patients on a ventilator. It's not clear that splitting the ventilators will expand that to 8 patients on a ventilator. It's also not clear that we even have 8 ventilators. Cuomo's, at least from what I saw from Cuomo and from which aligns with our predictive modeling that I'm seeing, he's saying, gosh, they received 400 ventilators. We need 30,000. And so I think a lot of people are doing a lot of things to try to avoid having to make difficult decisions about who's going to be on the ventilator and who's not, with the scarce allocation of resources. But there's no way around it. I think we're going to be there. And the worry that I have about splitting ventilators is that now, instead of assigning a ventilator to one person who can depend on benefiting from that, you've now said that 2 people are going to get less than what is ideal. And the reality is that the rate of, the death rate, the mortality rate with people who are so sick that they have to be on a ventilator is upwards of 80%, even with younger people. Some of the younger people are the people that we're being able to be liberated from the ventilator. But I'm worried that splitting the ventilators will simply hasten the inevitable. That's what I'm worried about. I'm also worried about our caregivers and physicians talking about using ECMO or ECLS during this time. That's one of our most resource and staff intensive interventions, and it's only 4 patients where the ventilator has failed. And I'm worried that, for instance, the amount of nursing staff that it would take to care for 1 patient on ECLS as routine standard of care the ability to care for 4 patients. And we've just decided that we're going to put that resource into that 1 patient. And the reality is that we're shifting from, in a pandemic and in crisis standards of care, we're shifting away from autonomy and individual decision making towards public health decision making and care for the common good. And I think that there's a lot of attempts to try to get away from that, to say, gosh, that'll never happen. And I think we need to instead lean into that and say, how are we going to do that? And I'm really curious. What can we learn from Victorian times, from pandemics, before we had ventilators? How were we with one another in community? How can we learn from those things? That's your expertise.
Well, I was gonna just add to that like one thing I've been saying on a few podcasts this week is just that I think that in the developed world, we're not used to we're so privileged to not have to believe that will ever affect us, like a scarcity of resources. I mean, to our downfall, I think we've literally, right, like killed the planet because we don't believe that we should have to ever deal with a scarcity of resources. And, you know, I think that people like us in this chat probably think about that more frequently than most people because it's part of our job. And even I really can't get my head around that. I've never had to in my real life, you know? So I can only imagine how much your average person is not prepared to accept that this could be our reality.
Well, I saw an article today exploring the possibility of blanket DNRs for all COVID patients. And obviously that's something that's people are discussing, and that's not necessarily going to happen. But Leandra, you work on ethics. What do you think about that?
Oh, so I've had so many thoughts over the last several weeks because currently I'm teaching one introduction to health communication class and then one advanced health communication class where there's so much uncertainty, information overload, misinformation, and just bombardment of everything going on that, I've had a lot of conversations with students and family members, classmates, and colleagues where we're just trying to figure out how to make sense of everything at a very base level, right? Particularly for those of us who are living through this type of pandemic for the first time. So for example, a few years ago when the Zika virus really hit, my first book, which I published with my colleague, Sarah Upton, focused a lot on the way in which the Zika virus chained out in public and international media discourses, both in the US and in Latin America. And what I think was really interesting is back then, from a media ethics perspective, the Zika virus was always framed by major, more dominant news outlets as being a problem that originated somewhere else and that impacted other countries, right? Particularly in a Guillain-Barré case and also in a reproductive case. Now, what I'm thinking about with the coronavirus, of course, with all of the racism accompanying it being the Chinese flu, the Chinese disease, and all of the xenophobia that's chaining out there, I'm also trying to make sense of in my own head on a constant basis how we can go back to the mandate of shifting from like our large American individualist approach to healthcare, personal healthcare, right, and personal autonomy, with the idea that we just need to stay home, right? So we're seeing all of these hashtags going out on social media, like I love the Spanish ones, right? Quédate en casa, quédense en casa, just please stay home. And in Salt Lake, for example, I'm on the communication committee for our Salt Lake Climbers Alliance organization. And seeing the conversations and the discourses play out here about my personal rights and my personal autonomy to go to the crags and climb as I please because I'm young and the coronavirus won't impact me. Like, as a health communication person, I've been trying to make sense of that in tandem with like trying to figure out how communities and organizations can actually create communication messages that get to the target audience and stress the importance of the social collective good, right? The fact that we could be carriers, the fact that it doesn't matter if you're going outside, like all of the efforts that are trying to dispel a lot of the myths about the virus and how it's transmitted and who it impacts. It's just, I think at the end of the day, the too long didn't read version is, I think the breakdown between the individual approach to autonomy and health and the larger social collective good. I think that's going to be one of the biggest things that's going to impact whether or not the curve can actually be flattened and we can get people to just realize how this impacts all of us collectively.
Yeah, it's what I'm seeing on message boards and so on is this the real sort of disconnect between, well, I don't think I'm at risk, or I still have the right to do what I need to do, and paranoia on both sides. Paranoia on the left that this is going to be a kind of moment for for the government to do things that we don't think are necessary or good, and paranoia on the right that also they don't think are necessary or good. I mean, it's the same paranoia, it's focused on different objects. But there is still a discourse around this being a hoax, around it being exaggerated, and that discourse seems to be stronger on the right. And I think in part that's because the messaging was so mixed.
Yeah.
Let us say.
Oh, yeah.
For so long.
I was going to add, I mean, one thing that brings up for me is essentially what has confounded our efforts epidemiologically in this is that we essentially have a healthy carrier situation, right? Mm-hmm. And I was just having this conversation the other day with somebody who had posted something about Typhoid Mary, and they probably were really annoyed with me because I posted like a novel on their Facebook page about you can't, the narrative that still persists 113 years later, that she was just this evil person who didn't believe that she was spreading this disease. Of course, it lied some of the lived realities of her being an immigrant, of her needing to make her living. But I was like, people are doing that right now. I mean, we don't want to believe that we could be spreading this disease because we feel fine, and we still, so to say that somebody is monstrous for doing that, I mean, either we all are or she isn't, right? And the example I posed in this Facebook chat was like, is the server who works an extra shift because they know we're all about to go on lockdown and they have kids to feed, are they evil? I don't think it's that simple. And it was the same reality with Mary Mallon.
Right. Yeah. Well, I mean, when you're operating in a hyper-capitalist situation, right, where undoubtedly so you have individuals in service positions who, I mean, I keep seeing that meme float around on Facebook where it says like, oh yeah, I like how the conversation is individuals in service positions should have X amount of wealth saved up, but then corporations, when they need a bailout, it's like, oh yeah, you're good to go. So like, for example, my dad in Houston has been involved in the restaurant industry for the last at least 40 years, if not longer. And I was having several conversations with him leading up to this in the last month or so about, what's going to happen if the entire city of Houston gets a shutdown, what's going to happen with the restaurant, what's going to happen with the employees, et cetera, et cetera. And I think part of the problem here, as we've all been mentioning so far, is the disconnect between the messages, right, and kind of the ethical impositions that end up getting put on individuals in these positions who have no other choice, right? Which is why I've been really heartened to see a lot of campaigns going around just at the Salt Lake level that say, support local mom and pop shops, pick up delivery if you can, get food to go, et cetera, because really this is who's getting hit the hardest here from the industry service level position.
Right. I'm seeing on the public chat, Kristen Soria, I think, is saying that the silver lining has been the community rallying around each other at distance, looking out for each other, and that she's been in her home for 11 days, but her neighbors are calling and asking if she needs anything from the store. And we are seeing more of that. There was a good story today about how Nextdoor, which is a neighborhood app, which is often a little bit combative and can be a little bit of a trash fire, has suddenly become a site of a lot more, actual community, which is what it aimed to be. And people are starting to actually turn to that idea of community as they're restricted to a smaller space.
I think, maybe that's one of the connections it's something I've certainly been thinking about in terms of Victorian literature and some of your work, Pamela. You've written a lot about this, but, you know, I think we see during these outbreaks in the Victorian period, we get a lot of the kind of individualizing approach, like what you need to do to be a good citizen is sort of maintain the boundaries of your body, police yourself, kind of keep, you know, put up borders, keep yourself more bounded and sealed off. And what I just keep thinking about how to, like, in the long term, how do we negotiate the paradox of this situation where in order to create a healthy community, we need to isolate ourselves. You know, in order to be socially responsible to our neighbors, we actually need to do a lot of that stuff. Like, how do we socially distance and isolate without subscribing to ideas that I think are harmful about bounded individuality, you know, and how do we kind of maintain communal responsibility and the kind of ethic of community while we are physically all separated like this?
I'm going to jump in real quick just because this is the subject of my book that's coming out.
I know.
I guess Pamela probably knows since it's in her book series. Yeah, like this has been on my mind so much that what I notice in my book is moments of people like pushing back a little and saying that, like, you know, what is a beating heart worth if we don't have other people to share it with? I guess that's sort of a simplistic, maybe cheesy way to say it. But I mean, yeah, you know, we don't care about viruses because we care about viruses. We care about it because they will kill the people we love, right? And I've kind of seen what I hope, and I hope enough of us can be loud enough about this so that when things are back to normal, we don't just let this kind of peter out. But I mean, we live in a world that I think would really like us to believe that we can do everything at a distance. That's more efficient corporately, right? Isn't it Andrew Yang who is always talking about automation? And I think people are really seeing that, like, you can't replace face-to-face interactions. I've seen these beautiful moments of people coming together on Zoom. Like, Pamela, normally you and I only talk like once a year at conferences, like something together. And usually Leah and I are talking like in passing as we're running back and forth to classes. So there has been great things, but I also think people are seeing, I hope that, like, I almost cried the other day when my daughter's preschool teacher was like reading her a story through a recorded YouTube video in an empty classroom. And my baby kept being like, hi, but like didn't understand why she couldn't say hi back. And I was just on sorry, I'm rambling, but I was just on a podcast yesterday with a comedian who, when I mentioned this, was like, yeah, we've, you know, us in the live entertainment industry have been struggling to get people to come to live shows for years as iPhone has taken over. And now everybody's kind of missing it. And so I'm hoping that enough of us in sort of the broader perspective of, oops, Andy left. Sorry, I think she wanted to bring up something about the DNRs, but I'm hoping that enough of us can be loud enough about that people don't just go back to their iPhones. I mean, myself included. I don't do enough live things, but I'm hoping we'll seek that out a little bit more now that we see, when we're stripped of that ability, how much it does bring to our lives.
Yeah.
I would add that to Jenn's question, that one of the things that's becoming really evident as we are stuck in our homes and relying on delivery people and supply chains that may be disrupted is how much, you know, we think we go about our day and we are, you know, sovereign beings. I mean, some of us are, and we do everything ourselves. But in fact, there is no one living in advanced society, probably in any society, that does not depend on the work of lots of other people. And in an advanced society, a complex society, that work is often invisible. And so you just kind of don't know it's there, and often it's not valued. And going back to Andrew Yang, who wants everybody should have a universal basic income, right? I mean, we look at the truck drivers who are still bringing us stuff, the delivery people, the people who are still cooking in kitchens and for takeout, all of those people who maybe normally we don't think about them much, and now suddenly they're looming enormously large. And of course, our frontline doctors and nurses, but also the janitors who clean hospital floors. God bless them, because they're keeping us all from dying right now.
Yeah.
I have thought about this just last night. That occurred to me, and I'm so glad you brought this up, because I was thinking how we define essential labor, and I was like, right now, it's the people in the factories making the N95 masks, right? Yeah. And those are the people that are the most, I think, left out of equations in a lot of like workers' equity and job security and health insurance, right? But now society depends on them, and it in fact already did. We're just now seeing it.
Yeah,
and we know that a lot of those people are actually laboring in places like Wuhan, because that's where a lot of our equipment or components comes from, and it's one of the reasons there have been disruptions.
And it raises really significant implications too about the racial ethnic disparities at play as well, particularly when you think about the racial ethnic makeups and populations of the individuals, the actual bodies doing the labor, right? Like I've been seeing several articles going around, really interesting, really timely and poignant, that focus on how, like, particularly in the delivery positions, a lot of Black and brown bodies are at stake, because those are the ones that make up a large segment of that group. And, another thing that I focus on, that Kari and I talk about this all the time, like the violence at the border and the bodies at the border, like I haven't seen as much conversation as I would like on the farmers and the laborers and everyone else who are still working incredibly hard to make sure that we're still getting the produce that we can eat. But it's like those bodies and that labor and that experience isn't even really part of the larger conversation.
Right. And again, just the sort of American privilege. And I think we can also say, as Jenn, I love the way you said this. I wish I had it when I was writing my book, bound individualism, that we think we just kind of live magically, but we've never had to live in a space where we couldn't get food, much less even one item, right? Like I've never even lived through a life where like I couldn't get oranges, like occasionally happened in the Victorian era, and so we're so privileged, and I think to a fault of not having to think of the people whose bodies labor and produce those things for us.
Yeah. This is making me think of, just the larger issue of dependency and how we're so uncomfortable, I think, especially as Americans, with the idea of dependency, being dependent on other people. There's a lot of great disability studies work on this idea, but I think, we are realizing part of, maybe we could call it a silver lining of this, is that we're having to acknowledge what it means to be part of a community and to be dependent on other people. And hopefully, I hope that one of the upshots of this is that we start to think about the value of human life outside of use value, like that would be one thing that I would really be, if we happen to think about that would be great, to think about how do we theorize the value of human life, or how do we articulate the value of human life without relying on a rubric of use value, the value of the life of the 84-year-old retired person who is not working.
My heart, Jenn, I love that. Can you just say that last part again? I want to remember it forever.
I don't know what I said.
It's like lack of use value.
How do we articulate, or how do we argue for the value of human lives without depending on a rubric of use value?
Yeah, and see, so like Amanda, hey Amanda, Amanda typed in the chat box, U.S. American individualism and embodied establishment capitalism, right? Like, can we even think about those two paradigms in conversation with each other, right? When in a capitalistic society, bodies are expendable, profits are the bottom line. But then, we have this need that Jenn focused on so beautifully, that talks about everyone's need and everyone's life being valuable, right? And it also reminds me of Laura's question as well. Like, does it mean that we need to learn how to live with this new virus? What I've seen some people calling on Facebook as the new normal, and then other people pushing back saying like we shouldn't romanticize this as normal because it's a pandemic and people are dying. So yeah, I'm curious to see what y'all's thoughts are on that, right? Like, what does it even mean to live with this virus for the unforeseeable future as it's impacting the service industries, the economy? I mean, our own experiences in academia and with everything else. Like, how do we make sense of this?
Well, I'm hoping that one thing that we can help people to think about is the way that, and I think you're all talking about this in different ways, the way that, you know, let us call it capitalism, depends in part, and the political sector, which is an overlapping but not entirely identical sphere, on a kind of ideological mystification, right? We talk about, oh, the nation should be self-sufficient and it should close its borders, and, you know, and these foreign workers are coming here. And, you know, if there's nobody in the fields to pick your radishes, you ain't getting radishes.
Right? Leah, you and me just did the same thing.
And if your medical equipment is manufactured in China, maybe this is not the time to introduce legislation blaming China for everything when everyone is struggling with the same overwhelming disaster, and we need to cooperate more than we ever have before. So, you know, possibly people are going to see that in sharper relief as things don't work as well as they've been. And again, when things are working well, most of the labor is invisible. That labor is becoming visible and will continue to do so.
I mean, maybe this is getting a little literary studies here, but I think, you know, maybe the vaccine is a good metaphor to think about how to live with a virus, rather than like, you know, at some point when we take vaccines, we incorporate some of what is threatening into our bodies, right? And by doing that in a controlled way, we're able to live with it, you know, to some extent.
I don't think that's two lit studies at all.
Me either.
One of my advisors, Rajni Sudan, that's how she taught vaccines, is you're taking a little bit of the risky foreign other into the body to preserve a greater life.
Okay.
And
I do want to just be really clear, because we just had an article published in I think it was the Federalist. It got banned from Twitter immediately, that suggested that we should encourage people to catch the coronavirus in a controlled way and thus build immunity. That's
I've seen that going around, but I didn't know what it was from.
Important to clarify that I do not mean that.
Exactly, and I know that you don't, but I know who might see this later. I really.
I was thinking of the idea of the new normal. You know, that at some point you can't. We may have passed the point of total containment, right? So we have to think about how do we, you know, how do we adjust? How do we find ways to work with what's going on now?
Right. And flattening the curve is I think part of that adjustment, you know, because it's our virus now. It's an American virus when Americans have it.
Yeah, right. Exactly.
So.
Yeah. Okay. Well, I'm going to wrap this up, because I think if I let us talk too long, then too many of y'all will feel like it's too exhausting to do again. So,
we'll have Andy back to address that issue around the DNRs that she had really important information for us, and we didn't let her talk.
I know. I got too excited about community and bounded individualism. I feel like it's my fault. I would love any and all of you guys that are able to do this same time next week. Don't feel obligated, but I would love to just keep doing this. I need to talk it out with people. So
thanks for organizing this, Kari.
Thank you, Kari.
All right. Bye. Thanks.
See you all.
See you next week.
Talk to you.
Bye.
Thanks again for joining us for this episode of the Human Capital Innovations Podcast. I hope you stay healthy and safe, and and that you have a great week.